Please.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. Well, we had our board meeting tonight at 6 o'clock, and this is going to be a great year for the Houston County Historic Society. I just got that feeling that we're going to have a great year, and everybody's going to be really impressed with our meetings and our programs and the things that we're going to get accomplished for 2015. Most of the board members are the same board members that were here from last year, and if we can pose on GE, we're going to get him to swear us in here in a little bit. All except for Kay French, she's our vice president this year that filled in for Nina Finley. So I'd like to hear a big applause for Kay French. Before I go on, I want to remind everybody that the next meeting is going to be February the 10th, and it's going to be at the Oak Brooks Retirement Center, which is on Substation Loop, and the meeting is going to be at 6 o'clock. If you get there at 7, some of the people are going to be in bed because they want us to be there a little early, and it's going to be show and tell. So you have to bring something 50 years or older is what we kind of ask, and they really look forward to us there every year, and it's always a nice program. So, you know, if I forget to tell them at the end of this, I hope that everybody shows up. Miss Betty, GE brought us a check. Can you cash this for us?
I'm looking for someone to cash it.
Yeah.
I can cash it for a small fee.
He tried to give me one last year, and I thought, yeah, all right. But I look forward to the program tonight with GE in the state of the county. We set up some more of the programs, and I'll update a schedule for us next month. Yes.
Would you like to add to that our July program?
Our July
It will
program.
be a panel discussion with Kay French, McKinnon, and a couple of mothers growing up on Main Street here.
Okay. Okay. We'll work that out between now and then. So.
Yep, that's awesome.
Okay. We've talked about the bricks. I think we kind of got that going in the right direction. We talked about the L&N Railroad Pavilion over there, and I think we got bids that are coming in on that, so we're going to see about redoing the names because some of them are sun faded and some of them are weather faded, and some of them, the trimming needs to be replaced, so we're going to take care of it. We're going to see about that. Just a note, in March the 16th, Jackie and Donald are going to do a program for Montgomery County on the wildflowers, like the program they did for us last year. So they asked them to come up and do a program. So if anybody wants to note that and go to the program in Montgomery County, I'm sure that they would more than welcome us up to that. So, and that's at 7 o'clock on a Monday night. Okay, we're moving on along. We got our 501c, and thanks to Rebecca and Stevens. She put a lot of hard work into that, I know, because it's not an easy task, and I think we'll send her a card of thank you and figure out a way to show our appreciation for it. So that was brought up in the meeting. Miss Betty, would you like to do a financial report for us, please?
Balance at the end of the November meeting was $3,698.79. We had income of 90 cents. Our expenses were $442.84, leaving a balance of $3,256.85 in the operating account. And the brick fund in that account is $1704.75. Our expenses that came out of the operating account were $200 for gifts, $44 for the ham for the Christmas kickoff giveaway, and Christmas dinner was $103.84. DVDs for $55, and our filing fee for the Secretary of State was $40. Total was $442.84. Balance of $32.56.85.
Okay. Thank you, Miss Betty. Fernando, do you have anything to add to the meeting tonight? To the open meeting, or, okay. I know I always forget you when you do, so I just want to make sure. They had a meeting last night with the Friends of the Bronson Hollister House, which is coming up for bids January the 24th, out at the Bronson Hollister House, which is on Scotts Road, which is right off of Buckeye and Scotts Chapel. At 1 o'clock on the 24th, on a Saturday, they're going to take open bids, and you had to certify and qualify to be able to bid, and there's going to be 4 groups that's going to be able to bid, and one of them is the Friends of the Bronson Hollister House, which Robin and Melissa chair, and so that's might be an interesting thing to just go out and watch, because I'm kind of curious of how it's going to end up, but you know, if you have any interest in the historic house, just show your support and maybe just go out and watch, but I just wanted to make that announcement. Melissa, you had a few things that you wanted to... Okay.
Almost everybody here knows me. I usually introduce myself. But November, when our meeting, we had the open house at the archives, and that really, really was a success again. We filled up the basement again, and we had a really good time. If y'all will remember, I had kind of a surprise. The Stewart Houston Times had donated a collection of photographs that they had stored in their office in Dover. And I had talked to the Stewart County Archives and asked them if they wanted the Stewart County portion of photographs for their archives, and they said they did. And right now I'm in the process of going through them because they're not divided up. And a lot of the photographs are pretty obvious that they're Houston County. But I have a box of Houston County, a box of Stewart County, and the miscellaneous that I don't know is a lot larger. So if there's anyone that would like to volunteer to come to the archives and help me figure out what county they might go to. These are not real old photographs. They're probably from like starting 70s up to today. And so, you know, a lot of them I can't tell. And some of you might be able to. So if you get with me, if you think you can do something like that. Yeah.
Do you still come to the courthouse?
Who? Oh yeah, 2 days a week.
Have you showed them to her?
Oh yeah.
Does she receive that?
Yeah. But, so if anybody just, pardon me?
Go to school age and all that kind of thing?
There's a little bit of everything in there.
I could probably love you to some.
Yeah, there's a little bit of everything. There's even some old stuff of GE back when he was young.
He wasn't on that report card she had though.
No. I'll tell you what, the archives actually has been inundated with donations of records so far this year. One of the first donations we got was from the Knight family, and I brought them. They're over there. They're very interesting for y'all to look at. They're scrapbooks that were done by Lola Knight. One scrapbook is the Retired Teachers Association scrapbook from 1973, and there's photographs, newspaper clippings in there. And the other one is a scrapbook of the various schools that Lola Knight taught at from the 1920s. And there's photographs, and there's enrollment pages. There's another enrollment book from the 1920s from, I can't remember which school it is, the 1921. But there's one from 1964 from the Arlington School. So after the meeting, you're welcome to look at those. And really the most exciting collection that we've received was actually from the library. The library board contacted the archives, and 39 years worth of, thankfully, collecting that Kay French did is now in the archives. They are Thurving binders, they're like scrapbooks, and she saved everything. And so we're calling the collection the Houston County Public Library Kay French Retired Librarian Collection. And we've actually applied for a historical grant through the Tennessee State Library and Archives for $2,500 to buy materials to help us preserve and archive this collection. So we've not been notified yet if we've gotten the grant, but so yeah, I have stuff everywhere in that room. But we're grateful that the library board decided to give those to us. So it's been just great. We've met all kinds of people. We've had lots of visitors. So, but on the pictures, if you are interested to get with me, I'll let you know when I'm in the archives, because the photographs can't leave the archive, but you're welcome to come and sit and go through pictures like I've been doing. And so, but they're great. They're really good pictures. So, thanks.
Thank you, Melissa. Okay, I think that covers everything. I'd like to introduce our speaker and our program, and I'd like to hear what he has to say about our county for this year. So we give a big welcome for our TE Clark.
Thank you, Jerry. And excuse me, my voice is like a lot of people's voices this time of year. I hope it stays with me. I've got a little problem with it later. It's always a pleasure to come and meet with you each year and talk a little bit about Houston County and go over some of the things that's happening here in the county. We seem to right now have quite a bit going on. The last year and a half has been real busy. But before I get into some of the things that we're going to do, I'd like to, as usual, tell you about where we are financially and about how we spend your money, because that's what it is. It's your money. Houston County, of course, has already passed its budget for this year. We passed it back in June. We have a budget now of $34,564,000. That budget is broken down, and we've broken it down into several more categories than what we have in the past. It used to be about 3 or 4, but now there's quite a bit more than that. Of course, the general fund budget for this year is $5,679,994. And out of that, the tax rate for Houston County right now is $3.19. Out of that tax rate, the general fund gets $1.87. Debt service, which actually pays for most of the things that we borrow, like for schools, ambulances, jail, courthouse, things of that nature. It has a budget of $2,500,459, and we only put 2 cents into that. Debt service has been in pretty good shape for many years. Schools gets 53 cents, and they have a budget of $13,914,000.
So they can't hear you.
Can hear? Okay. The highway department gets a penny. They've got that penny for many, many years, and we've not raised it a whole lot. We do that so that we can have a little say as to what goes on there, but most of their money comes from the state, gas tax and other funds other than actual property tax money. But their budget this year is $3,352,000. Solid waste gets 16 cents. It has a budget of $351,049. Hospital is the one that has been picked up. It gets 60 cents of your tax rate dollars, and it has a budget of $6,753,808. Community development, which is really, it doesn't get any tax rate money, but it's where we're doing some of our projects under, and it has a budget of $1,218,761. Capital projects, which has to do with the hospital, some of the things that we're doing up there, it has a budget of $2,996,000. And then we have another capital project, which is a water line project, and it's $525,000, which you'll see that the big check that's over to the side on that. But when you put it all together, we have a tax rate of $3.19. I think, as most of you as taxpayers realize, that we did have a tax increase this last year of 60 cents. All of that went to the operation of the hospital. And now, school notes. We built the school some, 10, 12, 15 years ago, a new high school, and did some renovation to some of our other buildings. We still owe about 9 years on that note. And that note, we owe about $6,665,000 on it. We're paying a real low interest rate on that. It's 0.240. It's unheard of. The courthouse, we owe about $905,000 on it, and the interest rate on it is basically the same as it's a school. The jail, we owe $1,031,000 on it, and it's at that same rate also. And then the hospital, we borrowed $7.5 million a couple of years ago in regards to that. I wish I could say it was at that .240 note, but it's a little bit higher than that. Houston County, though, when you look at the amount of money that we have as far as the budget and the number of people that we have, is your largest employer. The general fund, which covers everything other than schools, hospital, highway department, things of that nature, has 110 employees. The highway department has about 23, and these figures will fluctuate 1 or 2 up and down. The school system, the last count I had about 250, and the hospital has about 85. So we employ 468 people here in Houston County. Now, work-wise, and where we are in regards to our labor force, there's approximately 3,830 employable people here in our county. Right now, 3,530 are employed. That means we have unemployed approximately 300 people. Our unemployment rate right now is 7.8%. Last year, it was 8.4. Okay? The state's right now is 6.8%, and last year it was 8.5%. And then, of course, the whole nation right now is 5.8, and last year it was 7.3. That tells me, as a person that looks at those figures, that our economy is beginning to pick up, and people are going back to work. It's been a slow, hard process, but with these rates coming down like they are across our county, across the state, across the nation, you're seeing more and more people go to work. Now, some of the projects that we have going is a water project, and that's what the big check is about. This is the second year that we've applied for that, or the second time that we've applied for it. It's a $525,000 project. We've done this for many, many years here in the county. One of the things that I've always stressed since I've been in office is to get good, clean drinking water out into the rural areas of Houston County. And I'd say once this project is done, at least 95% of the population will have city water or good, clean drinking water. And I guarantee you, there's not another county around that can say that. Because it goes all the way out to Yellow Creek, where you live, or it goes out to all the way down to Danville. It's just spread out all over the place. And it's getting harder and harder for us to actually apply because I have to scatter the projects. It's not, the main roads are pretty much done anymore. But this particular project, let me tell you the roads that's going to be, that we're looking at, that we're doing surveys on right now. Brigham Branch Road, Buckeye Road, Old Sam Mathis Road, Coleman Lane, Bohegler Lane, Shiloh Road, Old Highway 13, Bateman Farm Road, and Bledsoe Lane. We're just about through with the environmental part of that. We have to go through an environmental phase before they'll allow us to do anything. That's pretty much done. I think you probably saw some ads in the paper. If you read that kind of stuff, it was in the Houston County Times where we're finishing some of that up. Our engineer is out doing the survey right now of walking the lines and pinpointing the houses where they are and the amount of footage that's on each one of these roads that I mentioned. I'm expecting this to, once they do that, then the drawings will be put together, then it'll be put out for bid. I'd say it'll be spring of the year before we can get it out for bid. But the main thing is we've got the money to do it, and we'll be adding these lines and good clean drinking water to these people that live on these roads here. Another project that's taken place and we've been working on for a little while has to do with the airport. How many of you fly? None of you? I always wanted to. I just never took the lessons to do it. And I can't find anybody that will go up with me anyway, I don't think. But my brother says I like to look around too much, what's going on when I'm driving down the road. But we've just finished the fuel station at the airport. It was about a $146,000 project. It's really increased the number of people that come into the airport. We really have a nice airport for a small rural county. We've done a lot of work there in the last 6-7 years. We've resurfaced it. It's got totally new resurface all through it. That was approximately a $400,000 project. We bought additional land on the eastern end of the airstrip, and we also on the southern side of it. And then, of course, now we're doing the fuel station. Our fuel, you think gas prices are high. Airplane fuel right now is $4.85, and we're the cheapest around. When we put this fuel station in, one of the requirements was we had an 8,000-gallon tank. I had no intentions of filling that tank up because I knew that there wouldn't be that kind of demand for fuel. But by law, I had to fill it up that first time, totally fill it. And so we reduced the price down lower than anybody around to just get people to come in to buy the fuel. Now, after this first time, then we won't have to do that again. But it does bring more people in, and of course it adds to our economy here, and it shows off what we have to do, or what we have in the western portion of our county. One of the next projects that I'm looking at there, on the western end of the airstrip, a lot of the people that fly in, they want to walk over to, or want to go to the Southern Air to eat. We used to call it $100 hamburgers, now it's $200 hamburger. But they want to go over there and eat. So we're looking at putting another turnaround and parking area on the western end of the airstrip there. We can apply for, and the state has 95% money. Anytime you can get 95% money, you better get it. It's not going to be there forever. So that's going to be our next phase there. Then the next thing after that is going to be adding some additional hangars. We've had 4 hangars there for years, and those 4 hangars stay full, and we do have requests for additional hangars. One of the things, though, I would probably do the hangars now, but you've got to keep a list of the people that are requesting these hangars, and it won't just let you write their name down. You got to put their airplane number down too. So that keeps you from saying, well, John over here has asked for a hangar. So you have to prove that there's somebody out there that wants those hangars. But we're going to start doing that because we do have people that want them. And hopefully we'll be able to add some hangars in the future at our airstrip. The Danville Park. How many have been to Danville lately? Okay. We have pretty much finished phase 1 of the Danville project. As most of you know, we leased from the TVA 56.8 acres with a 30-year lease on it. It took us about 3 years to get that done. It's unbelievable what you have to go through sometimes to get something through the federal government or through TVA. All the hoops that you had to jump through before they would give you a lease on that project. Not that they didn't want to give it to us. They didn't have a problem with that. It was just the process that you had to go through. But we got through with that, and we've got our 30-year lease. And we worked up probably a 12 to 13 phase project there. And we had money grant money to help do that phase 1 project. And the phase 1 project was a bathroom facility, about a mile walking. The bathroom facilities are done. They're open now. They'll be open year-round. They're heated, so it's electronically where you open the door, the lights come on and the heat come on, and it stays, and it'll shut off. It'll shut off after a certain amount of time. So we can keep it open all year round. And the walking trail is really nice. If you have time and you want to get out and walk, you ought to take the time to go to the walking trail. It starts there on 147, and goes all the way over to the ferry through the woods, and comes along the edge of the lake, and then circles back and comes back into the bathroom area there. Excuse me. That project was about a $130,000 project, and it was about an 80-20 grant that we got from the state. Now, where did the matching money come from? It did not come from property tax. The Tennessee River Resort Act was one of the best acts that we've ever passed here in this county, and all the counties that border the Kentucky Lake or the Tennessee River. We get about $5,000 to $6,000 a month from alcoholic beverage tax, and we don't even sell liquor by the drink here in Houston County, but we still get that. Some counties get a huge amount of money that actually do that. But it allows us to spend that money 3 miles. We can spend money on that 3 miles from Kentucky Lake. It's set up to develop the lake area is what it's for. But it allows us to do the things that we need to do in that area. Now, if you've been there lately and you've been by the ferry, the ferry road, I've had prisoners down there for the last couple of months clearing out the underbrush behind where the bathroom facilities are. There's a huge area there. I'd say it's an acre. I'm not, you think I'm about right? An acre that, at least, that's flat. And actually, it's got a lot of history to that area. That's where they got the bar dirt to build the railroad, build up the railroad base. Because when you go back, it's flat. And then all of a sudden it shoots straight up. So it's where they dug all that dirt out. You couldn't tell it now because there's trees in there this big around. So, but I've had the prisoners down there with a couple of guys clearing that out. We've moved picnic tables from down around the parking lot area, and we moved them over there temporarily, got them temporarily placed. I've talked to George Dew, our highway superintendent. George has agreed to go in and put rock and extend the parking lot where the turnaround is there, and that's really needed. You fishermen understand what I'm talking about. If you go there during springtime, there's just no place to park. But that'll add some additional parking there. We're also, George and I looked at it today, we're going to add a little bit more parking right beside the bathroom facility that's there. And then those picnic tables, we're going to scatter them out in that area that's been cleared, or not cleared, but the underbrush and stuff got out, and get some fire pits and some grills, and it'll be a nice place for someone to go this summer that wants to have a picnic or to camp out, primitive type camping there. That's not the long-range plan goal for that area, but it will take care of a need for right now until we can get some additional grant money to do some of the other stuff that we want to do in that area. Another place as far as the park, we looked at a park down at Magnolia. We're planning on doing a little work there. We're working with TVA on helping us with that and some additional work even at Danville. I was on the phone with them in Paris today, excuse me, in regards to them helping us secure and do some more parking and some picnic areas in both of those places. Excuse me. The ambulance building at Fire Station. All of you have seen it. It's been up for a pretty good while. That building is almost completed. We still have a few problems with it, with our contractor, but we're working in regards to that. But I'd say it's 95% done. We're using both of them. The ambulance building is in use, and so is the fire department in the basement. That project was a $750,000 grant. The county borrowed $200,000 to complete it to the stage that we wanted it at. The building itself, it's 7,700 square feet upstairs and about 2,000 square feet in the basement part where the fire department is. The 911 center, which is directly beside it, we have a general contractor here in the office, here in this audience, that oversees that project, Mr. Mike Davis. Mike walks across the road about every day and makes sure that those contractors are doing exactly what they're supposed to do over there. But that building is pretty much done. We're doing the punch list on it now. That particular building was a $761,861 building. It's a 100% grant also. The first floor of that building has 3,534 square feet in it, and the basement has about 1,238 square feet in it. The 911 center will take care of this county for many, many years to come. Another thing that's taking place there that we just had a pre-construction conference on is right beside that building, and I'm expecting Mike to oversee this one too. They're getting ready to build a 180-foot tower, freestanding tower, that'll go with the 911 building. We let that contract the other day. He's been told between now and February the 1st, he can start anytime he wants to. And that was about $96,000. So when you put it all together, $867,861 is going to be spent up there. The next project that's going on that's just getting started is at our highway department. This is this picture of this building here. I wish I had one in color, and I probably will before I get it completed, but I didn't have it today, so I couldn't bring it to you. The highway department building is started out as a $759,000, $450 project. We ended up adding another $117,522 to it. We started with a grant for about $1,009,000 something, and then we ended up, because we needed a little extra money, we went back to the state and we got another $150,000 additional grant to go with it. So we ended up about over $2 million for both of these. Thank you very much. I've had a glass of water. That particular building is, the office has 1,905 square feet. The shop has 5,404 square feet in it, and then has a mezzanine in it that has about 1,395 square feet. So you're looking at an 8,700 square foot building. It's being built right beside the jail. We bought 13 acres of property there, and it's under construction right now. Now, when you put all three of these buildings together, the ambulance, the fire, the 911, and the highway department, you're looking at $2,700,000 in grant money that was given to this county to build 3 facilities that we really needed, that you and I as taxpayers could have never come up with the money to have done. And we were fortunate enough to get that money, and those facilities will take care of the citizens of Houston County for many, many years to come. The industrial park. As you know, we have a new industrial building there. That building is about $1,597,000 structure. It's not totally complete yet. You've seen some other work going on there now, resodding and doing some drainage on it, but it's pretty much ready for us to try and recuperate some or get someone to come into it. It usually takes us, this is probably the 3rd one that we've done in the industrial park, and it takes us about 2 to 3 years once we get a building complete before we can find a company to move into it. But without that building, we would not have anybody to come look at our county. Excuse me, nobody's going to come just to look at land here. You got to have a structure. And we work with the state, we work with TVA, we work with Middle Tennessee Industrial Development to help bring people in to show the building. Now, at the industrial park, I call it the old Interfab building. It's the building that's right beside Southern Gauge. If you read the Stewart Houston Times, I think you realize that we've entered into a lease purchase agreement with Cumberland Plastics or Cryogenics LLC for them to lease that building, and to eventually, it's a lease purchase, and we'll be hopefully signing off on that in the real near future. We've done the paperwork, and it's a matter of doing an environmental, you've got to do an environmental phase 1 before somebody will purchase it. The purchase price is for $375,000. We've bought and sold that building many times. It's made the 2 counties a lot of money over the years, because we'd sell it, company would use it, they would get ready to leave, they'd want to unload it, we'd buy it for a little to nothing, we do a little work on it, and then we bring somebody else and put it back in it. It's been a real asset to our industrial park. Another thing that that's really affected our county this year has to do with the Affordable Care Act. Most of you probably don't realize it, but county employees under the general fund had no insurance. We did not provide health care for any of the general fund employees. The only people that were provided health care in Houston County were the certified, or the teachers with the school system basically, and the highway department. That all changed when the Affordable Care Act came in. We looked at it last year and went through a process and come up with a plan of how we could provide health care for our employees. And of course, according to the Affordable Care Act, if you have over a certain number of employees, you don't have a choice. You've got to provide it, or you'll be fined a certain amount of money. It's either $2,000 or $3,000. And so what we did, we looked at it to see what kind of policy that we could provide without paying the penalty for the number of employees that we'd have. And so it come up to about $120,000 to $130,000. About what our penalty would have been. So when we started looking at policies, we worked with some people in regards to that, and we do now provide a policy for our employees. It cost us about $160,000 a year to provide that for our county employees. It's something we should have done a long time ago. We've got people that have worked for Houston County for many, many years that have no insurance whatsoever. And we do not, I hate to say it, but sometimes we do not pay as much as other places do. And it even created an issue for us when, for these people to even pay the premium. We pay, the premiums that we pay right now, the total premium is $403 a month, and the county pays $355, and then the employee pays about $48. We have approximately, under the general fund now, and that's what I'm talking about, because each department, the school does their own, and the hospital does theirs, and the highway department does theirs. We have about 35 out of that 110 employees that are taking advantage of that plan. A lot of people, like, for myself, I already had insurance. I did not need it. And we have a lot of people, if their husband worked at TVA or worked at one of the other industries that provided health care, they didn't need it. So, but we did have 35 employees that did it. You had to base that premium. You couldn't just do it. An individual could only pay 9.5% of whatever their gross salary was toward a premium. So that throws a big kink into what you do too, because you got to take that lowest person and figure out what they can pay and try and make it fair. Excuse me. The biggest project, I guess, that we've got is back when we purchased the hospital. And a lot of people have the misconception that we purchased Patient's Choice Medical Center. Houston County did not purchase Patient's Choice Medical Center. We did not purchase a business at all. We purchased a piece of property. We bought a building and some equipment that was inside that building. And we started a hospital from scratch. We ended up going to the state, getting a new license, getting a new Medicare number, going through Joint Commission. We had 2 or 3 of those inspections. And doing all the things that had to be done. We had to renegotiate every contract that was up there. All the insurance carriers, every vendor that sold us anything, we had to renegotiate those contracts. So when you think about Houston County Community Hospital, it is a new business. It's not a business that's been here for the last 30 years. It's totally new. And it's gone through its growing pains. Some people had this notion, well, it would start making money all of a sudden. I've been in business for over 30 years. You don't go into business and start making money right off the bat. It takes a while, especially when you've had a business that was in the condition that Patient's Choice Medical Center was in. But I think we've had a good staff up there. We've had people that have worked hard up there. It's been there for many years. It's done an excellent job. That's hung in there with us when we bought that, or when the county bought that, to try and make it work. Now, some of the things that we've done, at first you heard me say we borrowed $7.5 million. Out of that 7.5, we set aside a certain amount of that money just for operating costs, because we knew you're not going to get any money until you get a Medicare number. Just not going to happen. Very small percentage of the people in Houston County have insurance. They're either on Medicare. Well, they have insurance, but it's through Medicare. They don't have a lot of your companies. If you work at TVA, or you work at the Walmart plant, or if you work probably Southern Gates, they probably have a pretty good insurance policy. But a lot of places they don't, and a lot of people don't here in the county. So you depend on Medicare to help pay for that cost up there. Until we could get that number, we were operating without any revenues coming in. And we operated several months like that up there. But we knew that in advance, and so we set aside money to do that. Now, some of the things that we've done, one of the first things that we looked at was the roof. If you walked in the hospital up there, that building, and if it was raining, you'd better have an umbrella. Going in the front door, it'd be leaking right in the front lobby. It was leaking all over the place. And you can't do any kind of construction on any facility until you get the roof taken care of, because you're just throwing money away. But we've done that. We bid that out. That cost us $393,000. Then the next thing was the heating and cooling units. They'd been there since the hospital opened up, some of it. So it wasn't working. We contracted that out. We bid that out. That cost us $480-something thousand, almost $481,000. Then, under the new Affordable Care Act, Medicare requires that you go to electronic billing. If you don't do electronic billing, they cut the percent of money that they give you. So you don't have much choice but to do it. And it needs to be done anyway. If you go to any hospital now, everything's computerized and it's all done. Of course, we had not done that. But we borrowed money to do that, and it cost us $260-something thousand. If you had been to the hospital, you noticed there used to be a bunch of trees out front. Those trees were destroying the building. They destroyed the roof. And the outside of the building was getting all dark and black. We've cut all those trees, and that didn't cost a lot, but that was about $3,500. Then we had to pressure wash the outside of the building to get all the dirt and debris from the trees off. That was about $19,000. Now, the building that's across the street from the hospital is what we call the administrative building now. That's if you go see Dr. Hill or the chiropractor, or if you're going to pay your bill, that's where you go now. Well, the roof and the gables around it, the gutters, all that is in disarray, disrepair. They had leaks on it. We bid that out now, and we've taken a low bid on fixing that, and that's going to cost us about $24,000. We've spent probably $1,180-something thousand right now on the hospital. We still have approximately another $1 million that we're going to spend on the inside of the building, and to do some upgrades inside that. We're going through right now. I was up there this last week for just about all day with our engineers, our architect, going through, looking at some of the things that we need to upgrade, like flooring, painting, things of that nature, and electrical, to improve the inside of the facility. The total operating cost of it, it costs anywhere from $400,000 to $500,000 a month to operate the hospital. And I think if you remember when I was going through the budget process, it's about a $6 million operation. Now, when we bought the facilities up there, not the business. And I stress that, because people need to know that. We bought property. They were having 1, 0, 2 patients a day at the facility up there when it was being operated under Patient's Choice Medical Center. No way to pay for itself doing that. This last month, we had as many as 14 patients. Today, we've had, well, it's gone from 14 to 4 or 5, but it was in the higher numbers this last month. Today, it was 12 up there. So, what I'm trying to get across is this. We went from 0, 1, and 2 to where we are. It's not going to happen overnight. You've got to grow your business back. You've got to provide the type of services that the people of Houston County need. We need to add the ones that we can that are profitable and that the citizens need. We need to look at everything that we've got going on up there. If it's not profitable and if it's not serving a need, just because we did it 30 years ago doesn't mean you're going to do it today. Healthcare has changed. It's a different ballgame altogether than what it used to be. And it's going to continue to change. You're going to see at the federal level and at the state level constant change in healthcare. It's a divisive issue politically. I don't want to get into that. But we own a hospital. And we need to support our hospital. Now, why did we buy it? We bought it because if you're having a heart attack, or if you've got an aunt or an uncle that needs health care, you don't have to go to Nashville. Or if you live in the western end of our county and you have something seriously wrong with you, I'm afraid if this hospital wasn't there, you're not going to make it. Our hospital is never going to be a place where you're going to do heart surgery. It's not set up for that. But it's set up to take care of your children, your aunts, your uncles, your mothers, your fathers, to stabilize them and to move them on to where they need to go. Or if we can handle it here, then we'll keep them here. We have good doctors here and good nurses and good staff. And I hear it a lot from people that go and stay in the hospital. They tell me that they get as good a service here or better than they get anywhere else as far as people taking care of them. And but that's where we are in regards to the hospital. There's still a lot of work to be done up there. There's still a lot of work to be done here in the county. There's always something coming up, and there's a lot of things that still need to be improved upon. But as far as a county our size, when you think of a county of 8,000 people, I don't mind saying it. We're blessed. We live in one of the prettiest areas of the state of Tennessee. When you come off this hill, coming into Erin in the fall of the year, I just as soon to come into Erin and see the fall trees as I had to be in Gatlinburg, Tennessee. Amen. It's just as pretty. We have a lake down here that 90% of this state and this country would love to live on that lake. We have it. All we got to do is have a vision and see it and improve it. We want to improve it the right way because we don't want to ruin the lifestyle we've got, but we want to capitalize on it too, because that's how we keep from having to tax you. And so, as county mayor, and as I'll have to say, county commission, I have a good commission. I've worked with them for many years. Most of them's been on there for a pretty good while. We have a few changes every once in a while, but they're concerned about your needs and what needs to be done. This last year was not an easy year, I can tell you. And this next year is even going to be harder. It gets harder every year because of the needs that are out there. But I enjoy being your county mayor, and I'm gonna, I don't have anything else to say. I think I've said enough, but I will open it up. I'll be glad to try and answer any questions that you have about what we talked about or anything else. If I know the answer, I'll tell you. If I don't, I'll tell you I don't know.
I have a question, Dee.
Sure.
The new program that Governor Hassel is going to accept with the affordable health care, is that going to benefit?
It can't do anything but help. When you got 170 or 200,000 people without health care, somebody's servicing those people. And who's doing that? Emergency rooms. If you go to our emergency room up here, Houston County has to provide you with health care. If you don't have any insurance, then we don't get anything. We eat that, or you eat it, taxpayers eat it. And by law, you can't turn someone away from a emergency room. Emergency rooms across this state have been used as doctor offices for people without insurance. Now, we contract out our emergency room. And don't get me wrong, we don't make a lot of money on emergency room. Where we make our money is when you come to an emergency room, but you need an x-ray, you need lab work, or you need something else. This is where we make our money. We actually contract out with someone right now to do our emergency room, to bring the doctors in, because you got to get enough doctors to operate emergency room. But yes, I hope, and I've spoken to both of our representatives, that they realize that we, and I'm talking about we, you and I, we own a hospital. And the only way that this hospital, and any hospital across this state is going to survive is that they have revenues. And without insurance, there's no way to pay. And so I'm really, and I'm not going to get in politically, but I agree with Governor Haslam. A lot of times I don't agree with him, but I agree with him in this respect. And I hope that it's done. It's not going to be easy sell for him, I can tell you. It's political across this state and across a lot of other states. But hopefully our legislature will see fit to expand that. You and I are paying for this anyway. Every time you send money in federal government, this money's coming from the federal government. Your money is going to another state. That's where it's going. When we don't take it, it's going to another state that's accepting it. But then you're being taxed here locally. Why? Because we're not getting some of that money. So, you know, well, I don't know. I'm not the smartest person in the face of the world. But it just does not make sense. Now, what you've seen, and I don't know if y'all keep up with it. I keep up with it because we own a hospital now. There's 3 hospitals that are already closed in the state of Tennessee. And another one's going to close in March. I heard it on the Paris radio. I listen to Paris radio quite a bit. Fulton City, I don't know if y'all know where that's at or not. It's about a 70-bed facility. And you'll see more. You'll see more rural hospitals close if something is not done to help offset the cost for the people that are uninsured. That's anything else. I mean, I could go on about it, but I just...
Well, I think, correct me if I'm wrong, but, you know, I know it's a tough decision for a county to do, but we look at this purchase price and trying to operate a business, which typically a county wouldn't take on an endeavor like that, just raising her hand and volunteering to do it, but it would have cost this county significantly if we hadn't looked it over. And I think we fall short maybe of maybe promoting that to where the people understand it. Or we would have been forced to increase our emergency.
Let me comment. What we would have had to done. Right now we have 4 ambulance vehicles. 2 of them are really up to par are decent vehicles. Two of them are just, they're old and they can't, we use them and we keep them certified, but they're not what needs to be. If they go out very much, they break down, we have to haul people in with another vehicle. But what Mr. Nolan is saying is correct. We looked at what it was going to cost us. We would have had, because of the transportation factor of transporting someone from this end of the county and everybody going to either Clarksville, Dixon, or Nashville, we would have had at least 1 to 2 vehicles outside the county all the time. So that meant we would have had to have at least bought at least 2 more ambulance vehicles. Those things are not cheap. You're looking at about $160,000 to $150,000 to $160,000 per vehicle to buy it and halfway put the supplies and stuff that you need on one. That's not counting the extra personnel. Because if you got those vehicles, then you've got to hire paramedics, EMTs, all of those people to staff those things 24 hours a day. We were looking at anywhere from $500,000 to $700,000 extra per year. That would have come strictly from your tax rate money.
If we didn't have a hospital.
If we didn't have the hospital.
If we didn't have a hospital.
Because we would have to transport everybody. We would be transporting people is what we were doing. Every time there was something that come up, they would have had to be transported.
We wouldn't have been able to use the airbag or airplane.
Well, we could use Airback, but the problem that you got with Airback, it's a good program, and we just helped our county employees in regards to that. But Airback a lot of times can't fly. Today, they probably couldn't come in. There's lots of times they can't come in.
I thought we had to have the emergency room to use it.
No. I mean, you could probably call them in, the EMTs and paramedics could call them in on the scene. But just a lot of times you can't use them. So, and you can't, you have no way of knowing when you're going to have a heart attack or when somebody's going to have a stroke or when somebody, and you know, if you don't provide them with the type of services, they're just not going to make it. So it was one of those things, and we looked at all of that before we jumped into purchasing. I'll have to say, Houston County was not wanting to go into the hospital business, I can tell you that. But I'll say this, if I had to do it again, I would do it again. Because I've lived here all my life. I know most of my neighbors. I know my family. And I want them to be taken care of. And so be it. I'm a taxpayer just like you are. It costs me a little money. But I'm getting a service out of it.
And nobody else was looking at the facility.
And nobody else wanted it. It was, nobody else would. There was no one else. We looked at that. We tried to find someone else to take it over. Because
so many people's lives have been
well,
saved because of that.
Well, here's the thing. The county is not in the business of doing a business that's going to be profitable that private enterprise can do. If private enterprise can do it and make it work, then we don't need to be doing it. But in our situation, our hospital was not profitable, was not, and we had people come in and look at it. There was no one that was going to take it over. It was one of those things. You either do it or there won't be a facility here. And then you're still going to have to upgrade your other emergency services and tax the people in regards to it. Any other questions in regards to it?
No, but I will say they've taken good care of me over the past few years. And I've been up there, both the emergency room and the hospital. And I've been to hospitals in Nashville. I have not been treated any better there than I was here. I can tell you, I'm sure glad we got our hospital.
I hear that all the time. I mean, I hear it from people all the time. Don't get me wrong. I hear the other. I hear it all. That's what they call it, the county mayor. I hear all of it. I hear the good. I hear the bad.
I don't think Bob wants to go home.
But we have a lot of people that do their rehab here. I mean, we have as good a rehabilitation center here, and that's owned by the hospital too. That's part of the hospital. Now, a lot of people don't realize this. A lot of people think that the county runs the clinic. No, we don't run the clinic. We just own the building. That's a different thing altogether. Hillcrest Clinic is owned by the doctors themselves. They do a good job, and we're fortunate. We have 2 clinics here, one up here and one at the hospital. I mean, we have, for a county of 8,000, think about it, 8,000 people. We have a dentist, we have two clinics, we have a hospital, we have an ambulance service, which is Class A. We have health care that, yeah, and yes, a nursing home, and I call it an assisted, for 8,000 people.
That's a bunch.
There's counties that don't have that, that's close by to us. Okay. Any other questions about anything? I mean, I don't get to see you but once a year. And excuse my voice. I can't, it's this time of year and it's just the way it is.
I'm so glad that phase one, you finally got it done.
Well, I can see, that's been a vision a long time ago. I've got records when we wanted to do this back in the 80s. Just never could get anybody to see what that could do. But it's coming to pass, and we've got a good tourism committee that works hard on trying to get that lease and get that phase one to where it's at, and now we're seeing it come to pass. And if we'll continue to do, and I say we, I'm talking about this county, we'll continue to follow that plan, and you can twerp it one way or the other as you go along, as the need is, then Danville will become well, it already is an asset, but it will become more of an asset for Houston County because there's just so much property that's adjacent to Kentucky Lake. And people want to be on that lake. We have people in here from Nashville, Franklin, you name it. I mean, they come down here, they spend their money. Then they go home. They spend the weekend, have a good time, have a place on the lake, and, we get their tax money. That's what we want. Tourism, that's what it's all about. We have people right now in this county that rent out cabins. It's on the internet, and I won't mention any names because that'd be against you in the play. But there's 2 or 3 cabins, and he has people in here from all over the world that comes in and stays 2 or 3 days a week in his place. Because he promotes it, and people see what he has, and they enjoy it.
There's another thing, I don't know how it happened, but somebody sees this county. The March 3rd, for anybody that wants to, Dr. Ming Wang will be at the senior center with the program.
Okay. Well, that's just like the Irish celebration, and I don't do a lot with Irish. I got my hands full.
Because it's always something.
But this little town and city and county turns into what, 15 to 20,000 people, just unbelievable what takes place in regards to it.
You all had to go in with the school systems and everything else, am I right, at St. Carlos?
Oh yeah, and I didn't mention. And I'm glad you mentioned that. That's one of the best programs that this state has ever come up with. I'm fortunate, and some of you are. I've got a college degree. I'm going to tell you, that college degree doesn't make me any smarter than anyone else. Now, there's some people think it does, but it don't. You've got to have a little common sense to go along with it. But only about 20% of people have a college degree. The other 80 has to do something. Now, Tennessee Promise is going to allow any student, this graduating class, this is the first class, this graduating class, 2 years of college, it's not going to cost them anything. Oh yeah. Now, most of them are going to be going to, there's a lot of the four-year colleges don't have 2-year programs. But they will. That's what I see. You know why? Because these students are going to start going to these other schools and they're going to start losing revenue.
That's right.
And so they're all going to start looking at some of these 2-year programs. But if a student plays his cards right, he can go on, he can get the 2 years, work toward this associate, and then go on and transfer to a 4-year if they want to go on and do that 4-year. But it'll also allow these students that want to, a vocational type trade. And guys, I can tell you now, I know we got one pipe fitter in the group. And plumber, they make pretty good money now. I keep up with those guys. I still pay dues. I still pay dues. I have no intention of going to work, but I still pay dues. Some of those guys make 30-something bucks an hour or dollars an hour, plus about $5 or $6 in retirement, plus so much for their insurance. They're making over $40 an hour. That's pretty good money. You can make a living doing that. That's a trade.
And right now, they can't get kids to go into their apprenticeship program. I don't know about the fitters, but I know the Boilermakers are having trouble, not just in this area, but across the country. Even with that kind of money and that kind of income, even going into their apprenticeship.
Because we're raising children that
Well,
don't get
I mean-
It's not the kind of work they.
Well, it's a little different, you know, you're not gonna wear the coat and tie now, you're gonna wear the Carhartts and you're gonna do that, but that's okay. I'm just saying, this 2-year program is another good program that I have to say the governor has come up with. And then I saw the other day where the president has attached it, and hopefully this will be across the nation. We'll see if the federal government will go along with that. But how many students did we end up? I appointed a committee of Kathy and a bunch of other people to work. It was a pretty good.
It's a pretty good number. It was up, what, 35 or 40?
Yeah, and here.
First you all had to have, in this program, you have to have mentors
Mhm.
who meet with, I mean, there are, it's just not, here's the money.
No,
We were in the, I'm a mentor for Tennessee Tennessee.
yeah.
And the library was full yesterday, students and there was 8 parents and volunteers.
What the mentor does, the mentor helps that person navigate through what they're going to be facing when they go to college, and helping them like FAFSA. Tennessee Promise doesn't just pay it all; it's the last resort. So what it does, if you get your FAFSA money, you get this money, your scholarship money, and then whatever is left, then Tennessee Promise will pick up the difference, so that those kids can go on to college.
At least they have the opportunity.
Oh yeah, I mean it's a great program, and it will build up our workforce. It'll make our workforce have more education and know how to do more. And I see a future for vocational things. You know, I may have a thing for that because I've come out of that program, but I think we've fallen behind in promoting those vocational things because everybody is not suited to work a computer.
Yes.
But they can make a good living as long as if they have a good trade.
And
Well,
the
he's gonna
schools
feel
need
that this misconception so many years, you've got to have a college degree, and that's not true.
No.
So many of them go to college, they get out, can't find a job, and living back with their parents.
Well, I don't mind saying, I went through a pipe fitter apprentice program, one of the best things I ever done. I did it after I had a college degree. I worked for Bill Mayo there for several years. He taught me a lot. He was a good supervisor. But I have used my college degree, because I was an industrial arts or industrial technology major, helped me when I went through that pipe fitter apprentice program, because I could already sketch and draw when I got there. I knew how to do that. Everything's now is computerized. I'm talking about years ago now. Now it's all computerized. But it helped me. So I'm not saying that a person shouldn't get that, go on and get it. But I'm saying that trade has helped me as county mayor ever since I've been in office. A contractor is not going to come in here and pull wool over my eyes. It's not going to happen. I've done too much of it. I've been around it too much. I can read that drawing as good as he can, and I know what he's supposed to do. And so I have a general idea. I'm saying that background of going through that trades, that pipe fitter apprentice program, helped me when I got out. I was really going to be a teacher. That's what I was going to be. And thank goodness those poor kids, they're blessed that I didn't make it that way.
I know a gentleman under the NAFTA free trade agreement, he got 2 years of trade school and he's got a pretty good computer business right now.
Well, I'm just saying, I'm saying a person should get as much education as they can, but they also, if there's any way of getting some type of trade to go along with it, because there's not as many jobs out there just with a college degree anymore, especially unless you specialize in a certain field. You got to get more specialty in regards to a college degree. And it costs so much now to go to college. Some of these kids they're in debt up to you know what when they get out. Anything else? We can philosophize all night long.
We'd like to swear.
Oh, yeah, be glad to do it. Okay, y'all, let's see. Why don't we're going to do the president, vice president, that's you, Jerry, and Kay, Vanetta, secretary, and Miss Betty, okay? Why don't y'all come on up? And I tell you what, y'all come up here, because that way y'all can just do it. You sit on that.
She's mad at me. She don't want to stand beside me.
No, she's gonna do July. No, I gotta get back here. I'm stabbing him in the
Now, when I read this, you say, I will. You've been elected by the Houston County Historical Society to serve as officers of this organization. To the best of your ability, you will promise to fulfill the duties of the office to which you have been elected, as those duties are presented in the bylaws of this organization. Well, you are now president, vice president, secretary, and treasurer for another year. Congratulations.
Thank you.
I'm going to get over here by the lady. I'm not.
I'm getting close there. Okay, 1, 2, 3. Gotcha. You will give that to the paper, won't you?
Okay, let's see. Our board of directors for this year, Gary Booker, Bob McKinnon, Sid McMillan, Lisa Barker, Donald Aikman, Peter Baggett, and Deborah Stenberg.
Come on, Bob.
We're gonna break the camera.
Mayor, and I'll say I will when we get through, just like it's married.
Yeah, there you go.
Liz, not the
Hold on a second, hold on a second.
Let's go to park. Wait a minute, she's home.
She's got her necklaces hooked on her shoulder.
Yeah, take it off, yeah, go ahead.
If I go to work.
That's all. Yeah. Just not work on it.
I'll take care of it. Sorry about that.
Okay, here we go. You've been elected by the Houston County Historical Society to serve on the board of directors for 2015. Will you promise to fulfill your responsibilities as a board member, attend meetings whenever possible, contribute your ideas and talents to fulfill the purpose of the Houston County Historical Society as laid out in the Constitution of this organization? Congratulations, you're trusted to hear the board of directors for 2015. I'll do an excellent job.
Thank you.
And, I didn't say anything about, before, and I know y'all want to go home, but we're very fortunate to have this lady running, Melissa. She does an excellent job down in the basement of the courthouse. In the basement of the courthouse, she's got everything organized. And the records, you cannot imagine how the board of records are, because there's records the county will need for many, many years that you'll have to go back and pick up. And at the old jail, we fixed up that basement, and it's totally different down there. So we're getting ready to put gas up there. I met with us the other day. So, but Melissa does an excellent job, and every time I come to a meeting, I hear she reports to you of what's going on. So that's good. Thank you.
Gary, if you don't mind, you should get into that. I will say that, and you may remember him from work, but a good friend of mine, Ross Hutchins, he's been to some functions here in the county. He wrote a book based on Civil War diaries and through the promotion of some of his books and he's been here and been in our archive. I worked with him on the job last year in Iowa. He told me more than once how good a historical presentation and archive that we had. He visits a lot of them, but he said what we were doing here and how we were approached was as good as he had seen it. And he was very complimentary of both Melissa and for our small rural county for having foresight to do it. And I thought that was a pretty good compliment. So with G being here, Melissa here, I don't come very often, but he has that ability to compare us, and he said we were doing extraordinarily well. So I think it's a great thing that we had the foresight to do that.
Well, like I said earlier, 2015 is going to be a good year for the Historic Society. I believe that. I got a feeling, and people are going to start looking at us more and more because, we do a good job. We got good people to come to our meetings and good board members and everything like that. So, without further ado, I'll make this statement that February the 10th, our next meeting is going to be at the Oak Brook Retirement Center on Substation Loop. It's going to be show and tell, so bring something 50 years old, even if it's your spouse. But they always enjoy us there, and we always have a nice turnout. So I appreciate everybody being here, and I hope everybody has a safe trip home. Thanks.